One of the most serious conditions in today's modern world is called pulmonary embolism. This is so serious that thousands or tens of thousands of people each year dying just from those problems. Pulmonary embolism is not just a chest discomfort. It is not simple anxiety, and it's definitely not just heartburn. A pulmonary embolism is a blood clot that suddenly blocks oxygen flow inside your lungs. It interrupts the normal circulation between your heart and your breathing system. And in most cases, it does not even begin in the lungs. It begins quietly in your leg, deep inside a large vein, where you cannot see. And at first, there may be only mild swelling, maybe a feeling of heaviness, maybe a cramp in your leg that you ignore. There's many signs that you develop blood clots in your leg. You can watch it on my, of course, my channel. But one of those most serious consequences of developing deep vein thrombosis in your leg is going to be remove those clots, and those clots go to your lungs and produce inflammatory process in your lungs. Breathing suddenly feel tight, your chest starts to hurt when you inhale deeply, and your heart begins to race without explanation. And many people dismiss the early signals. They assume it is fatigue and they blame stress. They wait, but when oxygen level begins to drop, the body reacts very quickly. And this is unbelievably important information. People that develop deep vein thrombosis, that develop pulmonary embolism just because of those problems, can really have very serious consequences in just a couple of minutes. What is exactly pulmonary embolism? A pulmonary embolism happens when a blood clot travels to the lungs and blocks a pulmonary artery. And this artery is responsible for carrying blood from the heart into lungs so it can pick up oxygen. In most cases, the clot does not begin in the lungs. It starts deep inside the veins of your legs, usually the calf or thigh. At first, the clot forms quietly. It may only partially block your blood flow, and you might feel swelling, mild pain, or warmth in one leg. But inside the vein, pressure begins to build up. And inflammation increases locally. In a fragment of that clot break loose, it enters the venous circulation. It moves upward through larger veins and it passes through the heart. And then it becomes trapped inside the artery of the lungs. Once there, it blocks oxygen exchange in the part of the lung. The affected lung tissue can no longer receive proper blood flow, and oxygen level in the blood starts to fall. Why is so serious? Because when oxygen level drops, pressure inside the lung artery rises, and the right side of the heart struggles. Circulation becomes unstable. How can you recognize the first warning sign that you develop in pulmonary embolism? Of course, first warning sign is going to be shortness of breathing, and you cannot breathe normally as you maybe a couple minutes ago. Suddenly, unexpected shortness of breath is often very first sign. You are sitting, you are resting, and you are not exercising. And suddenly you cannot catch the breath. It feels as if something blocks your lungs from the inside. You try to breathe deeper, but the air does not feel satisfying. This happens because the part of the lung is no longer receiving blood flow. Oxygen exchange becomes impaired with seconds, and this type of breathlessness appears suddenly. And does not feel like normal tiredness. This is unbelievably important. Second crucial information is going to be that you developing chest pain. When people usually get a pulmonary embolism in just a couple of minutes, developing suddenly sharp pain deep in her lungs. This pain is unusually sharp. It's not dull, it's not muscular. It often becomes stronger when you take a deep breath. And some patients say it feels like stabbing sensation. And you may also feel it when you're coughing, bending or turning your body. And this happens because the lining around the lungs becomes irritated when oxygen flow is disrupted. If chest pain worsens, specifically without inhalation, this is very important warning sign. Third signal that you developing blood clotting in your lungs is going to be unbelievably rise in your heartbeat. Usually people at this point feel a lot of stress, a lot of anxiety, and all this produce another sensation. It's going to be unbelievably fast heart rate. When your lungs artery is blocked, the heart must suddenly pump against higher resistance, and the right side of the heart becomes stressed. To compensate, the heart rate increases, and you may feel pounding in your chest or fluttering sensation. This is not anxiety causing the heart to race, it is blood reacting to the oxygen emergency. And of course, for clear signal is going to be those anxiety, those unbelievable stress in couple of minutes, because you feel something is terribly wrong right now. And this is all the symptoms that you really need spotted really early on, and you must immediately call emergency care. Emergency professional must come to your house or to your apartment. This is unbelievably serious signs. And many patients describe something unusual here. And they say, I suddenly felt something was very wrong, and I feel strange fear without a reason. This happens because oxygen levels are dropping and the nervous system senses danger. And the body releases stress hormones. Adrenaline rises rapidly, and that feeling of panic is often body biological alarm system. This is all is very, very serious. Another symptom that is unbelievably important is going to be your suddenly increase of dizziness and fainting situation. You are feeling like you are going to fall down, you are not feeling well. Dizziness also with fainting comes because oxygen supply decreases and blood pressure begins to fall and the brain suffers further. You may feel lightheaded, unstable, and like you might pass out. In more severe cases, temporary loss of consciousness can occur. And sixth symptom is going to be something with the blood, or is going to be produced coughing. And some people develop a dry cough, others may cough up blood-streaked mucus. This happens when blood-lungs tissue becomes damaged in the area where blood flow is blocked, and small vessels may rupture, and this produces blood in the sputum. Even a small amount of blood with sudden breathing difficulty requires immediate medical attention. As I said it before, this can happen just in a couple of minutes, and you are developing deep dose pulmonary embolism. This is very serious sign. And seventh signal that is unbelievably important is going to be leg symptom still presents. Sometimes the original clots is still in the legs, and you may still notice swelling in one leg only, tightness in the calf and warm over one area, redness or skin decoloration. And when leg symptoms appear together with breathing problems, this strongly indicates clots migration. And this combination dramatically increases emergency risk, and this part of episode is critical. Because pulmonary embolism rarely starts with the chest pain, it usually begins days earlier with silent leg symptom most people ignore. This is one of the crucial part of the video that you really need to remember. Deep vein thrombosis first shows in your leg. Maybe just a couple of days before you're feeling all those symptoms of deep vein thrombosis, and if you don't pay attention to these symptoms, and you can watch it in my video on my channel, you can develop those pulmonary embolism. This is unbelievably serious information. I believe you did learn something today, my dear viewers. So for everyone who watching me right now from any country in the world, you can call my office and seek my private consultations, and I'll be making sure that you get healthy again. If you are in the risk of pulmonary embolism, deep vein thrombosis, high blood pressure, heart attack, on any kind of serious chronic diseases, 26 years of working with the patient all around the world, call my office. I believe I can help you. My name is Mario. I am European medical professional with over 26 years clinical experience working with the patient all around the world. My core expertise include nutrition, natural medicine, physical therapy, and rehabilitation. Through my Mario Lab natural healing programs, I have helped thousands of people every year improve their health, regain mobility, reduce chronic pain and chronic diseases, and restore the quality of life. And those programs may help you as well. If you would like to visit my clinic in person, or if you prefer my personal phone consultations without traveling, my team and I are here to help you. Contact us via Viber or the WhatsApp at the phone number +385 98 9179 200. Your health deserves serious, professional, and individual approach. Thank you for following me. See you next time.